Hello, and welcome to this TED Ed lesson on the processes of person-centered care. According to McCormack and McCants, person-centered care is building trust, providing therapeutic relationships, and respecting individuals' values, preferences, and rights. For person-centered care to be obtained, 4 constructs must be achieved. These constructs are based on the McCormack and McCants framework developed in 2010. It is important to understand that this framework addresses healthcare on a large scale and that leadership, social care policies, and workplace developments should be in place. The first construct is the prerequisites. This focuses on the qualities of the nurse. The second construct is the care environment and addresses the way care is delivered. The third construct, which is this week's topic, is a person-centered process. This process includes providing holistic care, working with patients' values and beliefs, engaging authentically, sharing decision-making, and being sympathetically present. This process uses a variety of activities to deliver the best care possible. The last construct is the person-centered outcomes, which explains the results of effective care.
Person-centered care is about recognizing the value and importance of the person in front of you as a person, not just a patient, not just someone with diabetes, someone with atrial fibrillation, but someone with their own thoughts, their values, their beliefs, their understandings, and someone who needs helping and supporting into making the right decisions for them.
The constructs are linked together, therefore all 4 must be utilized for the best care possible. The main priority of person-centered care process is to provide care through a wide spectrum of different activities that include working with patients' beliefs and values in order to overcome the gap that is formed between the concept and reality of person-centered care. Through providing this type of care, it is able to create an incline in the patient's level of satisfaction with their care and can, in addition, decrease anxiety levels among most nurses, which would in turn foster a higher level of teamwork between staff members. Some relevant factors that are embedded into the care processes include the sharing of power between health professionals and patients in order to create a mutual environment where all individuals are equal to enable shared decision-making. Displaying empathetic consideration for the cultural values, beliefs, and opinions of patients. And creating a genuine sense of rapport with patients and their families allows a safe environment for the sharing of information. Evidence suggests that the relationship between person-centered care practice and holistic care is bidirectional. One sets the foundation for the other. The American Holistic Nurses Association 2012 defines holistic nursing as all nursing practice that has healing the whole person as its goal. This form of care means being able to provide healing for a patient's physical and psychological state, which ultimately dates back to Florence Nightingale. Florence Nightingale is considered the founder of modern nursing, wherein the relationship between healthcare providers and consumers is emphasized. Many things have changed since the era of Nightingale. However, the presence of illness and its effect on the population is not one of them. Working with patients' beliefs and values places an importance on developing a clear picture of the patient's values on life. McCormack and McCants express that knowing about another's values and beliefs requires caring about the other in a way that appreciates an understanding of each patient as an individual human being. An example of working with patients' beliefs and values would be in the case of a Jehovism, where ethnic beliefs prohibit blood transfusion. Having an enhanced understanding of the patient's history and what is important to them is a pivotal in personalizing a care plan. The practitioner has to respect the patient's beliefs and values even if it is not comparable with their own. Having a sympathetic presence is a part of the framework that requires an appropriate response on recognizing the uniqueness and value of the individual. McCormack and McCants describe the ability to project a sympathetic presence is therefore dependent on knowing the patient and having insight into their beliefs and values. An example of having sympathetic presence is when a patient experiences a loss. The nurse must recognize the uniqueness and value of the individual rather than empathizing on personal experiences. Having that sympathetic presence and understanding of the patient's loss can establish a therapeutic relationship between the practitioner and patient.
Person isn't an inconvenience. They are not a box on a list to be checked off. You are a part of their life now. your words, your face. So take that seriously and recognize the importance of your role. And respect the fact that that person's pain is the biggest thing in the room. You got it?
For successful person-centered care, the nurse must assimilate the best scientific evidence and the patient's values and preferences. These values and preferences are influenced by their beliefs, personal constructs, and their personal circumstance, including their age, family, and social relationships. When consumers' preferences are incorporated in the clinical decision-making, patient compliance or adherence to therapy is improved, thereby enhancing the overall recovery process. Promoting the concept of self-management is becoming rapidly more prevalent in contemporary healthcare. For example, by encouraging consumer participation, health professionals are able to foster behavioural changes. In some cases of chronic disease, behavioural changes in healthy eating are critical components in the treatment and management. One of the processes of person-centered care is engaging with the patients. Studies show that informed and engaged patients invest in their own healthcare as well as the improvement in the broader healthcare system, have better perspectives on their health and on the experience in healthcare organisations. Other studies have found that physicians have inaccurate perceptions of patients' health beliefs as they incorrectly assume that patients' beliefs align with their own. The misperception improves when patients are able to participate actively in their consultation. These studies highlight the need to prepare healthcare professionals with communication skills and techniques that epitomise opportunities for patient engagement. Leaders within any team play a vital role in establishing common objectives and maintaining the motivation to complete team goals. Covey established to embed a person-centered care approach, leaders must establish a central vision or goal and generate strategies to reach these goals. As a leader, one becomes responsible for driving the successful completion of the goal and are therefore considered a pivotal member within the team. A common problem encountered by leaders is whether or not they harbour the appropriate leadership style relative to the intentions of the team. Korn, Detroit, and Van Heerden highlight the importance of breaking down leadership hierarchy and creating a team who feel equal. A diminished power imbalance creates a nurturing environment and in turn facilitates the open interaction between consumers, staff, and other members of the team. Huber outlines 3 leadership styles in nursing: authoritarian, democratic, and laissez-faire. It is a leader's responsibility to employ the most effective style on their team. Therefore, challenges can arise if the style employed is ineffectively guiding them. Finally, leaders must be able to apply appropriate skills and knowledge that effectively motivate and help the team achieve their goals. Therefore, leaders may find it challenging to motivate their teams to overcome obstacles and challenges. If a leader is unable to motivate their team to complete tasks and overcome obstacles, the quality of work is affected, and within this context, inefficient practices of person-centered care will be implemented. To achieve person-centered care, the consumer must first be considered a full partner within the hierarchy of the healthcare team supporting them. This means that individuals are treated with equal respect and with the promoting of self-management feel more empowered in the situation. Multidisciplinary teams are an example of the initiative in the healthcare system, as people from distant areas of expertise work together to achieve the best possible care for the patients in all aspects of their life. Within these teams, extensive communication and knowledge of the patient helps to create the best healthcare available to them. This emphasises the patient's role in creating person-centred care. The Code of Ethics for Nurses in Australia has been developed to ensure equal respect and quality of treatment is given to each patient. Other regulations in the healthcare system ensure that information and activities are kept confidential, therefore strengthening trust and improving the relationship between nurse and the consumer. Another important policy, not only reserved specifically for nurses, is obtaining consent from patients. Consent from all activities and procedures allows individuals to make informed choices, which not only considers their physical well-being, but tends to recognise patients' emotional state too.
Furthermore, innovations to help achieve person-centred care come down to everyday procedures conducted by nurses. The conduction of daily patient-centred care plans and patient risk assessment, as they are admitted, reinforces patient safety and the continuity of care as patients' needs are attended to.
Thank you for listening to this week's presentation on the processes of person-centred care. This presentation explored 5 processes and the importance of person-centred care in the health system. One of the processes in establishing person-centred care is a holistic approach, taking into consideration everything about the patient, including mental, social, spiritual, and physical factors. A component of the person-centred care process has explored the ways in which nurses can work with a patient's values and beliefs. The nurse must also have a sympathetic presence by understanding the patient's individuality to be able to successfully create person-centred care. This care can also be established by sharing the decision-making with the patient and therefore engaging. Nurses adopt all of these processes to successfully enable the person-centred care. This is one of the most important parts of nursing, as it builds the trust between the nurse and the consumer through respect and understanding, and allows for a better health outcome.